I still have hair on my head, but I can't do a thing with it, so I thought I'd do a little Steven Van Zandt.
I am a publisher, writer, editor, daughter, sister, auntie, dog mom, and many other things, including currently a cancer patient. But I am not a doctor or medical professional of any sort. What you are about to watch is an episode of my journey through cancer. I'm sharing my adventure with you in hopes that you'll find something here that's comforting and maybe even inspiring. This video is not intended to provide any sort of diagnosis or treatment plan. Please go talk with your doctor for professional medical advice.
I've covered in sometimes graphic detail a whole long list of side effects that a cancer patient can experience when they're getting chemo or radiation, some that I have or am experiencing, and myself. Fatigue, diarrhea, infertility, which because of my age has not really been on my radar. But there are more, and I've got 3 of them right now. Lucky me. I went into my oncologist's office yesterday for another radiation treatment and, to resume my last week of radiation treatment. And I stopped at my nurse's desk and I asked her if I could be tested for a UTI or a yeast infection because I thought I had one or the other. Here's the skinny. When your pelvis is radiated, all the tissues and organs in that area are radiated too, not just the tumor. For example, it's not unusual for the inside of the bladder to become irritated, nor is it uncommon for all of the tissues in the area to become irritated too. Well, turns out I am currently wildly irritated. I have a UTI, a yeast infection, and very little bladder control. Which to treat first? Well, the ultimate cure is time. Time for the irritated tissues to return to their normal size and function as they heal. This doesn't mean that time is always on your side. Some radiation effects don't appear until 2 months after radiation is complete, and others don't appear until 6 to 9 months after radiation is complete. And radiation-induced sarcomas, they don't appear on average for 10 to 15 years after radiation is complete. That said, a whole lot of tissues and organs in my pelvis area are twice their normal size, and they need time to shrink back to their typical dimensions. But that doesn't mean there isn't anything, we can do about it in the meantime. Nothing we can do but wait. No. My oncologist gave me a prescription for an antibiotic to treat the UTI and for an antifungal to address the yeast problem. But because of potential drug interactions, I can't take both at the same time. Because the yeast problem is causing some itching that would be wildly antisocial if I did it in public, I'm going with a week on the antifungals, and then I'm switching it up to a week on the antibiotics, and then I'm going to go back to 10 days on the antifungal. And except for appointments with my doctors, I am not leaving the house because being more than a few feet away from my bathroom puts me outside of my comfort zone. So it's an imperfect solution, but what are you going to do?
If you liked this video, don't forget to give it a like, subscribe, and ring the bell. Also, don't forget to call your senators and your congresspeople to demand universal health care, and most importantly, don't forget to vote.